Hello, I am Dr. Jessica Dalton. I'm a veterinarian with VetRec, and I'm going to walk you through getting started. Getting started is so easy. All you have to do is hit this blue button. If you have time, you can put in the patient's name, but if you don't, all you would have to do is hit start recording and say your patient's name out loud, and it's actually going to generate the visit for you. Of course, I have some visits already pre-populated for us to take a look at. This is my test subject, Bree. Bree came into us with a lot of records, and I was able to upload those to the platform and get summarized information. All of this is template based, and we can customize this for you. So if you are in private practice, you're probably going to be looking for different information than you are if you're an orthopedic surgeon, and we can really customize it to fit you best. We also have, of course, the notes, again, template based, so we can get those notes exactly how you're wanting them, whether that's just normal SOAP notes for you, or if you are doing a dental or another surgical procedure. I also like to do discharges for all of my clients to make sure that we're sending home with lots of client education. And it's never simpler than to just hit this little email button. It's going to populate the discharge notes. I'll put in the client's email and off it goes. If I had questions and I didn't have time to really look through all of the records, or there's a lot, I can ask our AI David to help us out with that. So I could ask David, when was her last rabies vaccine? And David is going to look through the documents to find when the last rabies vaccine was. So it's telling me when it was administered and when it's next due. We can also use David to look up previous blood work results, really nice for when we're tracking some of those chronic diseases. Going back to the page, I can also make client calls right from the platform or right from my mobile device. I just go to add visit. Maybe I want to create a new note and I'm calling to let them know Bree is ready to go home. So I would hit new audio, phone. I could either go through the web, so through the computer. I can use VetRec's number so that they never see my number, or I can put in my hospital's numbers as well. I would just put in the client phone number. I could hit notify client. This is going to send a text message letting them know, hey, Dr. Dalton is giving you a call, so that hopefully they will pick up. Start call. As soon as I'm done, I'm just going to hit generate note. And I will have a note ready to go. If I wanted to use my cell phone or another phone in the clinic, I could just hit phone, call me at what number I want people to call me at, the client's number, and then they will call me at this number and then connect me to the client. Again, you can choose what template you're using to create your notes for your phone summaries. On this side, you can see that we also have a case board. I love the case board, especially if we're moving patients around or if we are having patients that are hospitalized. We can easily see where we are in the process of getting them ready to go. If you're heavy on surgery, you'll maybe have a pre-op column and a surgery column and a post-op column. We can customize these columns to really fit you as well. We also have our intake center. The intake center is a mailbox that we help you to set up that has all of your client communication coming into it and all of those referrals, and then those referrals can go directly into your medical records. We also have templates, so we talk a lot about our templates because this is so important to getting those notes how you want them. You can create your own template by simply dropping a case that you like and that's finished into the box, hit generate template, and that will give you a framework. Or you can go to start from scratch. That's starting hard, but you can definitely do it. Or you can go to use template library, and that's going to start you off with the bones of your template, and you can build it out from there. So depending on how you want to create your template, there's many different options. If making a template feels overwhelming or you just don't have the time, you can always request a template as well from us. We are live people, so you see this little chat box in the corner. We are live individuals. They are all veterinary technicians, veterinary assistants, ready to help you if you want to message them. And they are also the ones making the templates for us, and they are great at it. So don't hesitate to reach out either through the chat box or to request a template. Going down the side of our bar, we do have a settings tab, so you can look at your team settings and you can manage your team to see who's all members, and if you need to put any settings on to your team, you can do it here as well. We also have a VetRec IQ area. So this is where you can actually upload documents that you want David to search from and to reference for you. We also have a Snippets area. There's another video on Snippets, but I love Snippets for private practice because sometimes we're saying the same thing over and over all day. We're always going over carprofen, and this is just a very easy way to embed all of your carprofen information into your notes and into your client discharge. I hope that you enjoyed your tour of VetRec. If you have any questions, please again reach out to us in the chat box. Also, information can be found in the Help Center. So this will show you different articles, how to set up integrations for your PIMs. But again, any questions, you can always reach out. Thank you, and I hope you have a great time using it.